Hello everyone, welcome to PCE Final Frontier podcast. I am Shivangi, your PCE guide at PCE Final Frontier, helping one student at a time. Visit our website www.pceff.com to enroll in our courses today. Welcome back to Iontophoresis Part 2 podcast. In the previous podcast, we talked about 4 ions: calcium, copper, chloride, and tap water. And I gave you some quick tricks to connect it to remember what are those ions used for. Let's continue on the next few ones. So let's start with magnesium. When you think of magnesium, think M for magnesium, M for muscle spasm. Magnesium is often used to relieve muscle spasms. So just remember M and M, magnesium for muscle spasms. Next one is lidocaine. Lidocaine is a well-known local anesthetic. So just to remember it, remember L for lidocaine, L for local anesthetic. Very simple and straightforward. Now, the third ion is salicylate. This one's a bit trickier, but here's the trick. Think of SIP, where S stands for salicylate, I for inflammation, and P for plantar warts. So salicylate is used for inflammation and plantar warts. Just remember to sip this information. The next ion is hyaluronidase. It is used for edema, especially when relief is needed while keeping the affected area elevated. To remember this, think of high from the hyaluronidase as high elevation and hyaluronidase for edema. So that way you can remember it. And lastly, we have zinc. Zinc is used for dermal applications, more so for treating ulcers. Just think the Z in the zinc and Z for the dermal ulcers, like connect the phonic sound, ulcers, and the Z for the zinc. The last one, one more. One more combination to remember is DHS, dexamethasone, hydrocortisone, and salicylate. They are all used for inflammation. So just remember DHS as your inflammation trial. And there you have it. Quick and easy mnemonic to remember important ions and their medical application. So understanding polarity is very crucial in electrotherapy, and knowing which substances have positive can make a lot of difference for the treatment. So remember this mnemonic. Copper has high positive lightning magnetic zeal. Let's break that down. C for copper. Copper sulfate is commonly used in electrotherapy for fungal infections. H for hydrocortisone is used for anti-inflammatory effects, and it has positive polarity too. The other H stands for hyaluronidase. Think high for hyaluronidase. It's used to reduce edema, particularly when the area is elevated. Positive. So all these ions have positive polarity. P for positive. Lightning, L, stands for lidocaine. Lidocaine is used as a local anesthetic. Magnetic stands for magnesium. Magnesium is another agent and is used as a muscle relaxant. And zeal is zinc. Zinc is a positively charged ion used in the treatment of dermal ulcers. So all these ions have positive polarity. The rest of the other ions are all negative. So always remember the mnemonic. Copper has high positive lightning magnetic zeal. And so this will help you remember the ions that have positive polarity. And again, as I mentioned earlier, the rest is all negative. The rest are all negative ions. I hope these tips help you in your studies or in your practice. If you enjoyed this podcast episode, don't forget to subscribe and share it with your friend. Thanks for listening today. Until next time, keep learning and keep it simple. Thank you for joining today. Reach out to us at support@pceff.com for any questions. Follow us on social media on Facebook, Instagram, and YouTube for more content. Have a wonderful week and keep learning.